Hi guys, good evening. Welcome back to live section on ABG. Hi, good evening. Welcome back to my live. It is KP Health Official. So day after yesterday, I had taken the section on ABG live. In that live, I have taken up to the procedure. So today I am going to deal about the remaining part regarding ABG interpretation and remaining part. So quickly going to the topic, ABG is nothing but arterial blood gas analysis. It is used to prediction of the PO2 and PCO2 and pH levels and sodium bicarbonate levels. In that ABG report, there are also report will show the electrolyte levels, so nothing but potassium, sodium and chloride. Clear? And coming to the ABG interpretation, the simplest method is ROM, is nothing but respiratory, metabolic, opposite and equal. If the respiratory, if the pH and CO2 moving in the opposite direction, if in the metabolic the pH and CO2 moves in the same direction. For examples, lower pH and high CO2 is called respiratory acidosis. High pH and high sodium bicarbonate is called metabolic alkalosis. So I am repeating again, low pH and high sodium bicarbonate is called as respiratory acidosis. High pH and high bicarbonate is called metabolic alkalosis. Okay, and few of the conditions, in the conditions also ABG will be altered. The common ABG scenarios, in the COPD cases, obviously there will be the CO2 retention in their body. So the reason CO2 will be built up in their body, obviously in the ABG the CO2 will be high, and in that scenarios, in that cases, the pH levels will be decreased, and at the same time the bicarbonate levels will be increases. So that is called as compensated respiratory acidosis. So that the scenario is called compensated respiratory acidosis in the COPD cases. And another example of the case scenario in DKA, diabetic ketoacidosis, in that pH level will be decreased, bicarbonate level will be increased. That is called as metabolic acidosis. In the hyperventilation situations, so obviously the pH will be increased, so subsequently the CO2 level will be decreased. That is called as respiratory alkalosis. Got it? And I am repeating again, common ABG scenarios in the COPD cases, due to the COPD, the CO2 levels obviously will increase in their body. So the reason CO2 retention will be happen, and pH levels will be decreased, and sodium bicarbonate levels will be increased. In the diabetic ketoacidosis, the pH levels will be decreased. At the same time, sodium bicarbonate levels also decrease. So that is called as metabolic acidosis. In the hyperventilation situations, the pH level will be increased and CO2 levels will be decreased. PO2 levels will be same, remain like that as normal. That is called as respiratory alkalosis. So here are the few common errors will be arise during the procedure and after the procedure and intra-procedural wise. So that is nothing but when the staff nurses or any person drawing the blood into the syringe, do not leave air bubbles in the syringe. It alters the gases level. And another thing is always send the sample quickly. As much as possible, the ABG sample should be reached to the laboratory, and do not use the wrong puncture technique. So those are the persons who are doing the ABG, so they have to see the arterial bouncing, arterial pulsation. Okay, if they do the wrong puncture, the venous and arterial blood will be mixed up, they give the wrong reports. So okay, venous and arterial blood also will be mixed. Why? Because few of the persons will have the superficial veins at the radial junction. So if any person is puncturing, the blood will be mixed. So avoid the wrong puncture technique and prevent hemolysis with smooth handling. Okay, these are the common errors will be arise during the procedure. So coming into the summary and conclusion, we have now covered what is ABG, how to perform it, when to do it, and how to interpret result effectively. So if anyone not found the ABG, what is the ABG from the first step, I have already given the live yesterday. So you can find the few details regarding the ABG. What is ABG? What are the components in the ABG? How to take the ABG? And what are the requirements needed for the ABG? I clearly explained in that live. So please go and watch that live. Okay, I'm concluding with this mark. If you found value in this section, do not take a moment to like, comment, share, and subscribe to KP Health Hub Official. Thank you for joining me. Stay curious, stay updated, and I will see you in the next section. So, if anyone connected from the nursing background, please put your name or please give a comment in the comment section. If anyone from the medical background, give your comment. And if anyone from the common people and they don't know what is the healthcare sector field, so I will explain regarding that also. So please subscribe to my channel, please support to me. My channel name is KP Health Hub Official. Thank you so much. My channel name is KP Health Hub Official. Thank you so much.